Right next to me, I have, of course, Dr. Wan Nur Ibtisam, Director General with the Women's Department.
This evening, the police reported that in an incident involving 4 siblings, including 10-month-old baby, who are believed to have been abandoned in front of the guardhouse at the Perak Tengah District Council.
Yeah, the 4 kids. Yeah, they have been taken by our officers, welfare officers, and brought to the hospital now. They are already there.
Okay, so basically this issue has been under the ministry.
Yeah, it's like this. Once we brought to the hospital, we still also have to obtain order from the court to allow us to bring to our institution. So, but they are already in safe hands. Thank you to the public who have been alerting me about this. Actually, the minute I got it, I just told my officer, and they immediately went. But thank you to the public for alerting us on this. We share all this information so that we can act fast to save the children.
Yeah? Could you please tell us the update of the anti-sexual harassment tribunal? What is the status now? As far as we concerned, that is already approved in the, and what is the status now? Is it when is yet to be operated, or?
No, actually, it has already been approved in Parliament. So that's where we were allowed to do the advocacy. So now it is still advocacy stage, and tribunal will be coming up. As I've been mentioning, we should be starting by not later than end of December. So at the moment, we have already acquired one premise which is still under renovation right now, and while waiting for that, we will be operating it from our ministry in Putrajaya, and we are still waiting for the full appointment of the members of the tribunal. And then we have been given approval for 20 personnel, which they are still being interviewed. So all this is in the process, but we hope that we will be starting before January. Okay, so we are just waiting for the president to be appointed, because it is not within us to appoint. That's under the AG. President, deputy president, and we have 10 members of tribunal, which we also need the assistance of the AG, which we have had meeting with the AG after identifying the scale of the personnel. So he is determining that for us, so he will be assisting us, inshallah.
With increased investments from the government, of course, for GBV prevention as well as awareness, we will also be seeing an incidence in reported case of violence. How can we actually rationalize this from a lens that is holistic and actually helps us as a society to understand that this doesn't necessarily mean we're actually seeing more violence?
Yeah, thank you, Tamina, for that. I wanted to emphasize again, violence is a public health issue. It shouldn't be kept private, right? So if we improve the systems, as you mentioned, remember we spoke about the one-stop crisis center just now, the whole system of providing legal assistance, financial assistance, welfare assistance, shelter, medical, and so forth. So if those are improved, then we will actually see more cases of violence. And it's not actually a bad thing, because we want survivors to actually come out and come for the services. We don't want them to continue to suffer, right? So, and in a way, which means from a data perspective, when there are more cases, it actually means that they are finally coming out to report, which means cases that went unreported all this while are now finally, more and more are being reported. So it's not entirely a bad thing. We have to see it as a very progressive way, and it enables us to then tailor the programs in terms of supporting the needs of the communities. Yeah.